Health economics, introduction to economics, definition of economics. Economics is the science which studies human behavior as a relationship between ends and scarce means which have alternative uses. Lionel Robbins, definition of health economics. Health economics is a branch of economics concerned with the issues related to efficiency, effectiveness, value, and behavior in the production and consumption of health and healthcare. WHO. Terminologies of health economics. Health, a state of complete physical, mental, and social well-being, and not merely the absence of disease, WHO. Economics, the study of how limited resources are used to satisfy unlimited human wants. Health economics, a branch of economics concerned with the allocation of resources for healthcare to maximize health benefits. Demand for healthcare, the desire and ability of people to obtain health services at a given price. Supply of healthcare, the amount of health services that providers are willing and able to offer at different price levels. Cost effectiveness, a method to compare the relative costs and health outcomes of different interventions. Cost-benefit analysis, an economic evaluation where both costs and benefits of health interventions are expressed in monetary terms. Morbidity, the state of being diseased or unhealthy within a population. Mortality, the incidence of death in a population. Quality adjusted life year, QALY, a measure that combines life expectancy with the quality of health during those years. Purpose of economics. Economics studies how individuals, businesses, and societies use scarce resources to satisfy unlimited wants, ensures efficient resource allocation, identify ways to increase income, output, and standard of living, stabilizing the economy, maintain employment, control inflation, and prevent economic crises. Purpose of health economics, efficient use of healthcare resources, allocate limited medical resources for maximum health benefit, cost-benefit and cost-effectiveness analysis, ensure fair access to health services for all population groups, evaluating health policies, assess the impact of government programs, insurance schemes, and hospital management decisions. Dimensions of economics. Microeconomics. It studies the behavior of individual economic uses, helps in framing national policies, guides pricing strategies, assists in understanding consumer demand, provides basis for government policy and specific demand. Macroeconomics. It studies the economy as a whole, focusing on large uses, helps in framing national policies, guides central banks in controlling inflation, useful for predicting recessions or booms, aids in planning for economic growth. Types of macroeconomics. Cost of healthcare, direct cost, indirect cost, intangible cost, fixed cost, variable cost, demand for healthcare, supply of healthcare. Other dimensions. Health economics, allocation of resources in healthcare, cost analysis, cost benefit, cost effectiveness, cost utility analysis in patient care. Public health economics, economic evaluation of vacation programs, maternal child health. Nursing economics, study of nursing workforce, wages, training costs, and productivity. Positive economics. It is a branch of economics that focuses on describing and analyzing economic phenomena as they are, without making value judgment. Characteristics, objective analysis, descriptive, testable hypotheses. Normative economics. It involves making value judgments about economic outcomes and policies. Characteristics, subjective analysis, prescriptive, value-based. Now let's move to an expanded topic on economics, health economics. Introduction to health economics. Resources in health economics. Human resources. Physical resources. Financial resources. Technological resources. Scarcity in health economics. Opportunity cost, efficiency, production of health. Healthcare market. Asymmetric information, uncertainty. Third-party payment system. Government regulation and intervention. Market failure. Scope of health economics. Resource management. Demand for health care. Supply of healthcare services. Cost analysis and economic evaluation. Health financing. Equity and access to healthcare. Pharmaceutical and health technology economics. Public health and preventive care economics. Focus of health economics. Understanding demand and supply of healthcare. Resource allocation and efficiency. Financing and health insurance. Economic evaluation of healthcare interventions. Equity in healthcare. Health policy and regulation. Health as human capital. Areas of health economics. The areas of health economics include healthcare financing, healthcare delivery and organization, economic evaluation of health interventions, health outcomes and quality of life, demand and supply of healthcare, pharmaceuticals and medical technology, health policy and public health economics, global health economics, economics of healthcare services, financing, healthcare tax-funded system, social health insurance, private health insurance, out-of-pocket payment, related aspects, cost and resource allocation, uses tools such as cost-effectiveness analysis, CEA, cost-benefit analysis, CBA, to maximize health outcomes. Role of technology. Innovation in technology has increased diagnostic accuracy and healthcare outcomes. Health economics and equity. Health crises can lead to economic disruptions, reinforcing need for resilient healthcare system that balance with preparedness. Challenges in health economics. Escalating costs, inequitable access, ethical dilemmas. Sustainability. The economics of health and economic development, key concepts. Scarcity and resource allocation. Cost-benefit and cost-effectiveness analysis. Equity in healthcare. Healthcare financing models. Current Indian context and trends. Healthcare financing, public health infrastructure, essential medicines and affordability, digital health innovation, non-communicable diseases, governance and regulations. We can hence acknowledge the fact that economics is intrinsically tied to the healthcare system. Diving deep into health economics delivers insight into how the healthcare delivery system is supported by the economy.